Health, Cleophas Mailu, is currently before the National Assembly, the Health Committee of the National Assembly. Let's just cross over there and listen in.
That impression is not the correct one. This was initiated by the internal auditor. Not that it is wrong, but it's a document which we need to document that. Secondly, this document was submitted to my office on 29th, and yet it came out middle October is when the document became public. One may wonder, where was the document? Of course, there are two reasons. One, the internal auditor was supposed to clarify these issues with the auditees, which will enable me to engage with the leadership in the ministry. But secondly, I want to put to this committee that when the report was submitted to me, either 29th or 30th, on 31st, I traveled to Cape Town, came back on 3rd, and on 4th, I traveled to Cuba, came back on 8th, and on 14th, I traveled to Montreal, up to 17th. 18th, I went to UN General Assembly, up to 26th. That is a whole month of September, which I was away. Therefore, there was no way we were going to interact with the internal auditor, and therefore, I want to clarify the impression that report was sitting without being actioned. That is very important to me for that to be realized. Now, that document, I recall, is on 20th when we started receiving SMS. I received an SMS from a reporter, and I forwarded that to my principal secretary, which was a Thursday during Mashujaa Day. And the Friday we came back. The reporter was seeking comments on a document which we had not seen. And on 26th, that is when the document became public, when one of the section of the media reported on that document.